Hi, my name is Penny Booker, and this video will explain attention deficit hyperactivity disorder, or what's more commonly known as ADHD. So the diagnostic criteria for ADHD from the DSM-5 is a persistent pattern of inattention and or hyperactivity impulsivity that interferes with functioning or development. And it's characterized by the inattention and or the hyperactivity and impulsivity. So the symptoms have to persist for at least 6 months, and they're inconsistent with development, and they negatively impact social, academic, or occupational activities. Now I'll define some key symptoms of ADHD. So inattention. It's the lack of ability to focus on the task at hand. It's not due to defiance or lack of comprehension. So we need to be sure there's not an intellectual disability or other concern regarding comprehension and understanding. Likewise, outright defiant behavior, though it may warrant a clinical diagnosis, would not fit the criteria for ADHD. Hyperactivity refers to excessive motor activity, so a child running about when it's not appropriate, or excessive fidgeting, tapping, or talkativeness. In adults, hyperactivity might look like extreme restlessness or wearing others out with the activity. Impulsivity refers to hasty actions that occur in the moment without forethought and that have high potential for harm to the individual. So impulsivity may reflect a desire for immediate rewards or an inability to delay gratification. It might look like social intrusiveness, so interrupting each other's a lot, or making important decisions without considering the long-term consequences. So again, that might be more for an adult because children do that naturally, not necessarily as a sign of ADHD. So inattention. In children, they need to have 6 or more of the symptoms. For older adolescents and adults 17 and over, they would need 5 or more. And we need to remember that the symptoms are not solely a manifestation of oppositional behavior, defiance, hostility, or failure to understand tasks or instructions. So A, they may often fail to give close attention to details, or they make careless mistakes. So they might overlook or miss details in schoolwork, in work at their job. Their work may be inaccurate. B, they often have difficulty sustaining attention in tasks or play activities. So they might have difficulty remaining focused in lectures, conversations, or lengthy readings for older adolescents and adults. C, they often don't seem to listen when spoken to directly, so their mind seems elsewhere, even if there's no other obvious distractions. D, they don't follow through on instructions, and they fail to finish schoolwork, chores, or duties in the workplace. So they start tasks, but then they lose focus, and they can be easily sidetracked. E, they often have difficulty organizing tasks and activities. So they have difficulty managing sequential tasks, keeping materials or belongings in order. They have disorganized work or poor time management. F, they often avoid, dislike, or reluctant to engage in tasks that require sustained mental effort. So schoolwork or homework, certain responsibilities at their job, completing forms, reviewing papers. G, they often lose things necessary for tasks or activities. So kids, you might see it in books or school books, papers, pencils, things like that. Adults, they may lose their tools, their wallets, their keys, their important paperwork, cell phones. H, they're often easily distracted by extraneous stimuli. So for older adolescents and adults, that may include unrelated thoughts. I, they're often forgetful in daily activities, doing chores, running errands. For adults, it might be returning phone calls or paying bills and keeping appointments. Hyperactivity and impulsivity. Again, for children, they would need 6 or more of the criteria to be met. For adults and older adolescents, 17 and over, that would be 5 or more. And again, it's not just oppositional behavior or hostility for these criteria. So A, they often fidgets, they may tap their hands or feet and squirm in their seat. They might leave their seat in situations when remaining seated is expected, so they leave in the middle of class or in the middle of a work meeting or other times when they're supposed to be remaining in place. They run or climb in situations where it's inappropriate. So in older adolescents and adults, that might look like feeling restless more so than actual physical climbing and running around. D, often unable to play or engage in leisure activities quietly. E, they're often on the go or acting as if they're driven by a motor. So they're unable to be comfortable staying still for an extended period of time. So restaurants, meetings, school. They may be, others may see them as being restless or difficult to keep up with. F, they may talk excessively. G, often blurts out an answer before a question has been completed, so they complete other people's sentences and they seem to not be able to wait their turn in the conversation. H, they have difficulty waiting his or her turn, so while in line for something, as an example. And I, they often interrupt or intrude on others. So they might butt into conversations, games, or activities. They might use other people's things without asking. And then adolescents and adults, they may intrude into or take over what others are doing at the time. Diagnosing ADHD. Several symptoms need to have been present before age 12. So I believe I mentioned before that you really need to look at what is normal developmentally, especially for children, because many of their normal behaviors could be misinterpreted as ADHD, such as not wanting to sit in school, or being restless during a long lecture from a teacher. That's all very normal. However, the symptoms do need to have been present before age 12 for it to be an ADHD diagnosis. It's important to have informants. So you don't want to rely on one adult's memory of their childhood symptoms because they may misremember or misinterpret, which can be detrimental to their potential diagnosis. Several symptoms need to be present in more than one setting. So if you have a child or an adult who is only showing signs of ADHD in school or at work, that may indicate a problem in that particular setting. However, it may not be a true ADHD diagnosis. And it must interfere with normal functioning. So they have to interfere and reduce the quality of their social, academic, or occupational functioning. And then it would not occur exclusively during a course of another disorder, drug or alcohol use or withdrawal. Similar to many other diagnoses, you would not want to make that diagnosis if the behaviors are happening, for example, if they're only happening when they're withdrawing from alcohol use, or if they have another mental health disorder, that may be more appropriate. So it is difficult to diagnose young children due to their developmentally normal excessive activity and their other behaviors, which again I mentioned may be very normal. And mild speech, motor, or social delays may co-occur with ADHD, but are not a symptom. So if you're noticing that in a younger child, it doesn't necessarily mean that they have ADHD. You are often able to recognize symptoms of ADHD in elementary age children, and many parents and teachers, this is when they originally have the child tested. So typically in preschool age children, the hyperactivity is more prominent, where older children will have difficulty with inattention. During early adolescence, the ADHD may remain stable, but then older adolescents and adults may find themselves feeling really restless, and then they struggle with impulsivity and poor planning. Specifiers, they would have to be met for the past 6 months. So it can be a combined presentation where you have both inattentiveness and hyperactivity and impulsivity, or you could have a predominantly inattentive presentation or predominantly hyperactive or impulsive or impulsive presentation. It could be in partial remission, or it could be mild, moderate, or severe. You can add that specifier. So mild would be if few, if any, symptoms are in excess of those required, and then it's no more than minor impairments in their functioning. Moderate is somewhere in the middle between mild and severe, where severe would be many symptoms in excess of what's needed to make the diagnosis, or you have several that are particularly severe, and then there's marked impairment in social or occupational functioning. So the differential diagnosis, you'd want to rule these out first. As you can see, there's many listed here, such as oppositional defiant disorder, reactive attachment disorder, autism spectrum disorder, personality disorders. For older adolescents or adults, substance use disorders may cause a lot of these symptoms. So make sure you're ruling any of these out before making an ADHD diagnosis. So this is a video of an adult male who was diagnosed as an adult with ADHD when he was 43 years old. It's very informative, but it's also light and funny. The gentleman who is being interviewed really talks about what his experiences were, which may not have been outwardly recognized by others. So we have a good overview in the DSM of what's needed to be diagnosed with ADHD, but this is someone saying how he felt and how it impacted his life. So I think it gives a really good, overview of what it's actually like for someone rather than just looking at the cut and dry criteria for ADHD. Thank you for watching my video.